I have operated on hearts that should never have needed surgery. Patients in their late 60s on the table for coronary bypass. Arteries so blocked that the only option left was to reroute the blood supply entirely. Patients who had been told for years that their blood pressure was managed, that their medication was working, that everything was under control. And it was, on paper. The numbers were acceptable. The prescriptions were being taken. But what was on the plate every evening was quietly undoing everything the medication was trying to accomplish. I am not going to tell you to stop your medication. I am not going to tell you that food alone solves high blood pressure. What I am going to tell you is what I wish more of my patients had known before they needed a surgeon. The right foods, eaten in the right way, work through the same biological mechanisms as the medications I prescribe after surgery. They reduce arterial inflammation. They relax blood vessel walls. They lower the pressure that is damaging your arteries right now, while you read nothing unusual on your morning cuff. 5 specific changes, starting tonight. My name is Dr. Emmanuel Osei. I'm a cardiovascular surgeon with over 2 decades in the operating room. And today I'm going to show you 5 simple ways to lower your blood pressure with food, from a surgeon who has seen what happens when these changes come too late. Stay with me. The first change is eating your vegetables before everything else on the plate. When I explain this in a consultation, the reaction is always the same. That cannot possibly matter enough to mention. Here is why it does. Every time you eat carbohydrates, bread, rice, pasta, potatoes, your blood sugar rises as the meal digests. Your pancreas releases insulin to bring it back down, and that insulin surge causes your blood vessels to constrict, to tighten. At the dinner table, your blood pressure is spiking and you have no awareness of it. The fiber in vegetables, eaten first, forms a physical barrier in the stomach that slows glucose absorption from everything eaten afterward. Less glucose spike, less insulin, less vasoconstriction, lower pressure in the hours after the meal. A simple sequence change produces a measurable difference in post-meal blood pressure. Same food, different order. What to do? Tonight, before you touch the rice or the bread, finish every vegetable on your plate. Every meal, every day. It costs nothing and requires no special ingredients. The second change is 1 tablespoon of apple cider vinegar and water with each meal. The active compound is acetic acid, and acetic acid does 2 specific things relevant to blood pressure. It improves insulin sensitivity, reducing the magnitude of the post-meal glucose and insulin response that constricts your blood vessels. And it stimulates nitric oxide production in the walls of your arteries. Nitric oxide is your body's own vasodilator. It is the same mechanism that an entire class of blood pressure medications targets, but produced naturally from within the arterial wall itself. Never drink it undiluted. 1 tablespoon in 8 ounces of water, with a straw to protect tooth enamel. If you have a history of acid reflux or stomach ulcers, speak to your doctor first. What to do? 1 tablespoon in water with breakfast, lunch, and dinner. Give it 3 weeks, then check your numbers. The third change is 30 grams of walnuts, about 14 halves, 30 minutes before bed. I have discussed nocturnal hypertension in other videos, the blood pressure surge that happens between 2 and 5 in the morning while you sleep. Most patients have never had their nighttime pressure measured. Their morning reading looks fine. The overnight damage is invisible. Walnuts contain alpha-linolenic acid, a plant-based omega-3, along with melatonin and L-arginine. This combination relaxes blood vessel walls, reduces vascular inflammation overnight, and supports the natural nighttime pressure drop that a healthy cardiovascular system should be making every single night. As a cardiovascular surgeon, the idea that 14 walnut halves before bed measurably supports the overnight pressure profile is not surprising to me. The mechanism is clear. The intervention is simple. What to do? Keep a small jar of walnuts on the kitchen counter. 30 grams, 30 minutes before bed, every night. The fourth change is 3 cups of hibiscus tea every day. Hibiscus flowers contain compounds called anthocyanins and hibiscus acids that inhibit an enzyme called angiotensin-converting enzyme, ACE. The same enzyme that ACE inhibitor medications target. The same mechanism. I prescribe ACE inhibitors routinely to my post-surgical patients. The fact that a plant compound produces the same enzymatic inhibition is not alternative medicine. It is chemistry. The mechanism is identical. The magnitude of effect is smaller than a pharmaceutical dose, but real and published. A study in the Journal of Nutrition found that daily hibiscus tea reduced systolic blood pressure by an average of 7 points. 7 points from a cup of tea. In the context of medication management and dietary change, that is a meaningful contribution. One important caution: if you already take an ACE inhibitor medication, speak to your doctor before adding regular hibiscus tea. Combining 2 ACE inhibitors, one pharmaceutical, one botanical, can push pressure too low. What to do? 3 cups daily, morning, afternoon, evening. Hot or cold. Minimal sugar. The 5th change is replacing your cooking oils. This is the one that takes the most explaining and produces the most resistance, because people have been told for decades that vegetable oils are heart healthy. The research has moved on significantly since that recommendation was formed. The oils that line most kitchen shelves, canola, soybean, sunflower, corn, are high in omega-6 fatty acids. In the right ratio with omega-3, omega-6 is essential. But the average person over 60 consuming a Western diet consumes 15 to 20 times more omega-6 than omega-3. That imbalance drives chronic systemic inflammation, the same slow arterial inflammation that I see in the vessels of every patient I operate on. The inflammation that stiffens arterial walls, raises baseline blood pressure, and makes plaques unstable. These oils also oxidize when heated. They break down into compounds called aldehydes that are directly toxic to the endothelial cells lining your arteries. Every meal cooked in these oils introduces oxidative damage to vessels that are already under pressure. Extra virgin olive oil for low and medium heat. Real butter, not margarine, for higher heat. Margarine is made from the same seed oils you are trying to eliminate. What to do? Check your cupboard tonight. If you have canola or soybean oil, stop buying it when it runs out. Replace it with extra virgin olive oil. That one change, sustained over months, reduces the inflammatory burden on your arterial walls measurably. I want to tell you about a patient I'll call Arthur, 71 years old. He came to me for a preoperative evaluation before a planned coronary bypass. Significant 3-vessel disease. His cardiologist had recommended surgery and referred him to me. During our consultation, I asked about his diet. He described a reasonable diet, not excessive, not obviously unhealthy. But when I asked specifically about cooking oils, about vegetable intake timing, about whether he drank anything before bed, the picture shifted. Canola oil every day for 30 years. Carbohydrates first at every meal. Nothing before bed except occasional alcohol. Blood pressure medication taken faithfully every morning. The medication was managing the number. The diet was generating the inflammation that the number never fully captured. I performed his bypass. He recovered well. But I also sent him home with 5 specific dietary changes. The same 5 I just described to you. At his 6-month follow-up, his hsCRP, the inflammation marker I use to track arterial health, had dropped by 40%. His cardiologist reduced one of his blood pressure medications. He told me something I have thought about often since. He said, "Nobody ever talked to me about food before the surgery. Only after. Only after. When the bypass was already done. I am talking to you about it now, before you need a surgeon. Let me bring this together. 1. Eat vegetables first at every meal. The fiber slows glucose absorption and reduces post-meal vasoconstriction. 2. 1 tablespoon of apple cider vinegar in water with each meal. Improves insulin sensitivity and stimulates natural nitric oxide production. 3. 30 grams of walnuts 30 minutes before bed. Omega-3, melatonin, and L-arginine support the overnight pressure drop. 4. 3 cups of hibiscus tea daily. Natural ACE inhibition, published 7-point systolic reduction. 5. Replace seed oils with extra virgin olive oil and real butter. Eliminates the primary dietary source of chronic arterial inflammation. These 5 changes work through the same mechanisms as the medications prescribed after cardiac surgery. They do not replace your treatment. They work alongside it, to give your cardiovascular system the conditions it needs to protect itself. Start with 1 tonight. Just 1. The vegetables, or the walnuts before bed. 1 change that costs nothing and that your arteries will register by morning. I want to hear from you. Which of these 5 are you going to try first? And has your doctor ever talked to you about food in the context of your blood pressure, not just medication? Tell me in the comments. I read every single one. If this video gave you something important, share it. Not for me, for someone in your life who is managing blood pressure with medication but has never been told that what is on the plate matters as much as what is in the pill organizer. Send this to them. It could change everything. Everything I've shared today is based on current cardiovascular research and my clinical experience as a cardiovascular surgeon. This is general information, not personal medical advice. Never stop or reduce any medication your doctor has prescribed without speaking to them first. Always consult your physician before making dietary changes, especially if you take blood pressure medication or blood thinners. Take care of your heart. It has been working for you every single minute of your life without ever asking for anything in return.